Alright, I'm going to come into the room. I'm going to introduce myself to the patient. I'm going to tell the patient the procedure. And while I'm talking to the patient, introducing myself, I'm going to wash my hands and I'm going to pull the curtain for privacy. And I'm going to tell our patient here that you're going to be needing an insulin shot today, and it's going to go right in your belly.
Give me.
Yeah, so it's going to go right here in the belly area, and the patient's going to feel just a little poke, and you're usually going to use a 3/8 to 5/8 inch or to 1 inch needle. You're going to use a 3/8 to 1 inch needle, and it's going to be a 28 to 31 gauge needle in diameter. The size of the syringe is going to be a 0.25, 0.5 or 1 mil syringe. Today we're going to be injecting insulin, so it's going to need to be measured in units, not in milliliters. And the needle that we're using today is a 1/2 inch needle in 29 gauge, and we're going to double check the 5 rights of patient safety for medication administration. Right dose, right patient, right time, right route, right drug, and so we'll begin. We've gotten the drug and drawn it up from the med room. We're gonna go ahead and we're gonna go to the patient's room. We've already double checked our medication twice. We're gonna go into the patient's room. We're in there. We've already done all of our pre-procedure introduction, hand hygiene, and privacy. I'm going to explain to the patient what the medication does, why they're taking it, and why it's being prescribed to them. Then we're going to go ahead and select a site for the insulin injection. It can either go in the adipose tissue of the abdomen, the triceps area, in the fatty adipose tissue behind on the back of the arm, or it can go in the upper buttocks area of the patient. Or it can also go in the outside portion of the thigh. So we're gonna begin. We have the drug and the needle pulled up here. I'm gonna let the patient know we're gonna clean the spot where we're gonna give medications, and so hold still. And so we're going to go right here is where we're going to go, right in the adipose tissue of the belly. And she's got just a little bit, so we're going to probably end up using the 1/2 inch or 3/8 needle. And you're going to pinch up some skin, but you're going to clean the site first, and you're going to start in the middle and work your way outwards. And you're going to tell the patient, make sure you don't touch the area that you cleaned. You need to keep it clean. You're going to take the needle, and for our purposes today, I'm not going to remove the cap because I don't want to actually poke my daughter. But we're going to have the needle drawn up with the insulin. We're going to double check again with the MAR to make sure. And the site is clean. We're going to go right here, and we're going to let the patient know that there's going to be a quick little poke. And so you're going to pinch up some skin, and you're going to go at a 90-degree angle. You're going to poke directly in a quick, smooth manner, and then you're going to inject the drug at 1 mil per 10 seconds. And in the case of the insulin, it's a small amount, about 1/3 of a mil, so it only takes about 3 seconds. And then when you're going to hold it there for a few seconds and remove the needle quickly. You're going to blot the area with a 2x2 piece of gauze of any blood, but you're not going to massage the area due to the fact that it could cause unwanted drug effects. And then I'm gonna wash my hands, discard my gloves, and make sure the patient is in a comfortable position, and we are done with the administration of insulin.